Welcome back. If you're just tuning in, you're watching the Arthritis Show. Joining us today is Dr. Natalia Kogan. Dr. Natalia Kogan practices chiropractic medicine here from South Florida. Welcome, Doc.
Thank you so much for
having me.
Great to have you. Absolutely.
Well, today's subject is back pain and osteoarthritis. I'm sure you get your share of that quite often, right?
Absolutely.
What percentage of your patients would you say is back pain? A lot of it, probably, right?
70%.
70%. Mm-hmm. Okay. And do you see spinal stenosis in your practice?
We do quite a bit, actually.
That's a little bit more difficult. That's one of the more difficult situations that we see with back pain. And what happens is the spinal canal starts narrowing because of osteophyte production and degenerative joint disease, and start pressing on the nerve and the spinal cord, causing all kind of problems. For in your practice, do you have more females or males?
It's about 50-50.
50-50.
I find that women tend to take care of themselves a little better and maybe more willing to get in and be seen more frequently than men.
And that's exactly what we see as well. We see that ladies come take care of themselves more, and men usually blow it off, and they kind of live with their pain.
Men come in acute situation more often. They wait until the last minute, and so the treatment tends to be a bit more difficult.
Fantastic. So what else is new right now in the world of chiropractic?
Chiropractic neurology, or functional neurology, is kind of my specialty, should I say. And in regards to back pain, one of the things that we see is that as people age, and maybe we don't move as much, we tend to lose some of the proprioception that comes in from our paraspinal muscles, which are the muscles that are in the back of the spine. And then we start to lose a little of balance, and we start flexing forward. And as this happens, the muscles in the back, they lengthen, and they tend to not be as responsive to situations of what we call titubation. That means those jerks like walking down the stairs and maybe missing a step. And those situations tend to cause a lot of problems, because all of a sudden the body is not able to respond neurologically, reflexogenically, and now you have spasm. Now you have an injury. Now you have a disc that may have been a little bit fragile because you haven't been working actively to support that area. You know, we're not working the land like we used to do back in the day. And
you may be doing something simple and just damage the whole area.
Absolutely. You know,
something that you used to be able to do it all the time when you were younger, and now, you know, something simple that you were picking up, and now you try to pick it up, and it's
yes, and the reason for that really is because your muscles did not turn on when they needed to turn on. That signal did not come in quickly enough to respond quickly enough. So we have to battle with reflexogenic aspects. And what we do for that is a lot of balancing type exercises. I believe you have a video of how we perform manipulation to the spine, and that's a big part of it, but you have to work on the integration of the paraspinal musculature, and also your core, your abdominals are extremely important.
What are some of the exercises that you would suggest to your patients to strengthen up some of these abdominal muscles?
Very simple, you know, crunches is the first thing. Leg extensions, range of motion, you know, moving in each and every single direction, every single morning. Lubricate those joints. Standing on one leg for 30 seconds and then on the other leg for 30 seconds. Try to do that with your eyes open and then move on to eyes closed. And if you can see that there's an imbalance in that aspect, then you come in and you have to rehab that area. So whether it's with more of the balance exercise, it's very important.
To our audience out there, the core or the abdominal muscles are very important. Like the doctor said, strengthening them up very important. What I like to recommend to our patients, because some of our patients, you know, who are older, they cannot do much sit-ups or push-ups. We tell them to, you know, suck the stomach in as much as you can till you can't tolerate it anymore. And initially, you may be able to do it like 10 seconds, but eventually you can build up to around a minute. And at that point, your core is very strong, and that will definitely help the back pain. Well, at this point, I want to go to my co-host, Mr. Roman Garcia. Roman, I think you had a comment or question you wanted to make.
Dr. Cohen, exactly what is it that why is the abdominal muscle so important for a healthy back? What exactly does it do physiologically, biologically in the area?
Very simple. Every time we have movement in any part of the body or through a joint, and I'll use an arm as an example. If I want to move my arm this way, you have to turn on your primary muscle, and then your antagonist on the back has to support it to prevent the joint from dislocating. Well, if you're using your back musculature to lift or to turn or to perform any specific function, you have to use the abdominals as your antagonists to maintain that core function. If they're weak, then you can't have proper function of your low back. The joints become unstable.
So it creates disorder in the low back? Is that one way of looking at it?
It causes instability of the joint, and in turn that will cause inflammation. And of course we don't like inflammation because inflammation allows white blood cells to come in. The whole process comes in similar to acute
Not only that, it would also leave some, whenever you get an inflammation in a joint, you would leave some remnants behind, such as like osteophyte, for example, that it is very difficult to reverse these areas. And even when we do cell therapy on the patients, these areas are very resistant to improving if there is very, very inflamed. Absolutely. All right. I wanted to thank you again.
Absolutely.
Do you have anything else to add at this point?
Well, a couple of, I have a holistic clinic, so we use some herbs in the office, and one of the main ones for acute pain that I wanted to mention was licorice that's available throughout, and it's specifically for spasm and inflammation. And also, I like sea cucumber, and that's for osteoarthritis and also for rheumatoid arthritis. It has natural sterols in there, which is like a steroid. But they're natural, and they also allow for anti-inflammatory aspects.
So the last thing that you added, let's go over that, sea cucumbers?
Yes, sea cucumber, there's a tonic by Health Concerns is one of the companies that we use.
Is this something that people can buy from
yes,
groceries?
Absolutely.
Yes.
Absolutely. They typically come as a tonic, so they work on the kidney and on the liver. So kidneys tend to run the function of the bone through, this is acupuncture medicine. Liver tends to have more of an effect on tendons and muscles and ligaments. And so as you detoxify those organs, or those channels, I should say specifically, what happens is you have this anti-inflammatory effect that happens as well.
Fantastic. Roman Garcia?
I got one more question for Dr. Kogan. So in your clinic, what you're seeing is that most low back conditions start at the soft tissue level?
Most of the time, unless it's a traumatic incident, most of the time people wake up and they say, gosh, my back hurts. Or I've been over and my back hurts, and it's something that we've been doing day in, day out my entire life. So we have to evaluate and find out if there's what it is that we can do, whether it's physical therapy, whether it's spinal manipulation, because the joint just isn't moving freely like it needs to. Locking of the joint can actually cause pain in itself, and also your muscles have a tendency of having what's called muscle memory. This is the muscle spindle, which looks like a little spiral within the muscle. The muscle memory resets within 3 days. So if your muscle was lengthened and now it's contracted because you have spasm, after 3 days the body thinks that this is normal, this is the new normal. And that's not a good situation if your joint is misaligned.
So the balancing therapy or the balancing approach to low back conditions would apply across the spectrum of low back conditions, whether it be a disc issue or just soft tissue.
Absolutely, absolutely, because that affects all the reflexogenic component.
Well, fantastic. Dr. Kogan, I just want to take a moment and thank you personally for coming, joining our show. You were very, the information you gave us was very important for patients out there. We would love to have you back again.
Absolutely.
Also wanted to thank Ms. Catalina Flores, who was here earlier. Please make sure you join us for the Friday show. As always, we bring you the latest in sports medicine, arthritis. Have a great day.